My name, again, is Leah Kramer. I'm a licensed clinical social worker for Community Health Resource Center, and I appreciate you taking the time to join me today as we discuss habits that promote wellness. So I picked this topic, as Twin said, in response to the incredibly challenging year we've had between the multiple effects of the pandemic, between all the losses, the way we've had to restructure our lives, the economic fallout, as well as the reckoning that our country's faced on racial injustice that took place starting last summer, the growing political divisions that we've had, particularly following the election. So it's no wonder that we're all experiencing high levels of stress. And it's very understandable why we're seeing more people seeking behavioral health care in response to all of these stressors. And as a wise former patient of mine or client of mine pointed out, the coping mechanisms that we're used to using when we're feeling stressed out, anxious, depressed, are not necessarily available to us as they once were due to COVID restrictions, such as getting together with loved ones, going to public places like restaurants, museums, theaters. So we've had to be a little bit more creative and intentional about our self-care. Sorry, there's my introduction slide. So here we are. These are the 3 habits we're going to be discussing today: gratitude, getting out in nature, and mindfulness, which can help everyone and not just those suffering from depression and anxiety. And I was focusing on these habits because they're evidence-based to provide psychological, social, and health benefits. So are these habits difficult? And the answer is no. However, if we're setting to create a habit, the goal has to be realistic to be achievable. And practicing any of these for a few days may provide happiness or relief in the moment, but to have a lasting, meaningful effect, we really need to make them habits. And so I'm going to allude to this in various parts of the lecture, but I wanted to make clear that content in this presentation is not meant to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical or behavioral health condition. And as I talk about these habits, they should be seen as an adjunct or a complement, not a replacement to interventions that are recommended by your providers. So we'll go ahead and start with the first habit, which is gratitude. And I really liked this quote: "Gratitude turns what we have into enough and more. It turns denial into acceptance, chaos into order, and confusion into clarity." And what gratitude can do is that it has us focus on what we have rather than what we want, and it keeps us in the present. And that's really important because we often experience joy as something that's fleeting, as our minds tend to get used to things, and then it wants to move on to the next thing to make us feel better. And gratitude helps us to recognize our gifts as they are in the present and helps us to consider what got us to this point. And there have been many studies on the practice of gratitude, and they found that people who consciously count their blessings tend to be happier and less depressed. It also decreases negative emotions such as envy and materialism. So let's start by talking how gratitude affects the brain. So various studies have used brain imaging to locate areas of the brain activated by gratitude. And studies have shown that in MRIs, gratitude lights the medial prefrontal cortex, which is the area associated with understanding other people's perspectives, empathy, and feelings of relief. It's also the area connected to parts of body and brain that regulate emotions and support the stress relief process. Gratitude also makes our brains release serotonin and dopamine, which are feel-good neurotransmitters, and they help us to feel good immediately. And so what that can do for us is that it can create something called a virtuous cycle, or basically the opposite of a vicious cycle, where you get that feel-good feeling rush of gratitude. And then your brain starts to look for more things to be grateful for, looking for that next rush. So the more we look for and find things that we're grateful for, the more we realize how fortunate we are. And we can actually strengthen these neural pathways by regularly practicing gratitude. But again, only if we make it a habit and keep practicing. So some good news is that gratitude becomes easier as we age. Research has shown that experience of gratitude is greatest in older adults. So you may notice at Thanksgiving that the older members at the table are naturally going to be better at expressing and reflecting on gratitude. So if you're asking why, it's still a bit unclear. Researchers are beginning to unravel the biological and developmental explanations. However, some neuroscientists have pointed out that older people tend to have a more optimistic outlook because of the limbic system. An area of the brain involved in emotional attention and memory becomes less active in response to negative information. And at the same time, older people maintain or even increase their reactivity to positive information. So how does it help us? Is the next question. Well, for one, gratitude bonds us to people. So simply stated, we can improve our relationships by expressing more gratitude. So it's intuitive to assume that if you're on the receiving end of generosity or kindness, it makes you feel better. But research has shown us that gratitude actually improves the relationship for both parties, not just the recipient. And feeling grateful helps us to identify people who are responsive to our needs. And it helps us to bring us closer to them. Or again, more simply, if someone does something nice for you, you're more likely to want to build a relationship with them. And people who are grateful exhibit characteristics that are more attractive to other people. So grateful people tend to be less angry, less reactive, and they express more positive feelings. So naturally, this is going to increase bonding with others that promotes stronger relationships. And not surprisingly, gratitude has been shown to improve couple relationships. So researchers have found that individuals who feel appreciated and valued by their spouses also feel more strongly about their marriages, more committed to them, and hold the belief that it will last. And spousal expression of gratitude was found to be the most consistent predictor of marital quality. And one of the reasons identified is that gratitude can interrupt the cycle of negative communication patterns in their relationship, patterns that may be a result of current stressors that they're experiencing. So most studies on gratitude have been focused on the general population. However, there have been several studies conducted on subjects that do suffer from disorders such as anxiety and depression, and have shown that gratitude also has a positive effect on their symptoms. So this particular study, which came from the University of Indiana, the subjects were university students seeking counseling, mostly for issues related to depression and anxiety. And again, just to remind you, this gratitude intervention was not the sole intervention. All of the subjects in the study were receiving counseling. So in this experiment, group one was asked to write one letter of gratitude to someone each week for 3 weeks. Group two was asked to write about their deepest thoughts and feelings about a negative experience. And group three was given no writing activity. So in the two writing groups, group one reported significantly better mental health 4 weeks and 12 weeks after the writing exercise ended. And again, that is the group that was asked to write the gratitude letters. And in the two writing groups, group one used more positive emotions, less negative emotions than group two. But it was the decrease in the expression of negative emotions that had the greater effect on their mental health. So we can see that the effect gratitude may have is by shifting attention away from toxic emotions, such as resentment and envy. So if you think about it, it's very hard to hold both gratitude and envy at the same time. A very interesting note about this study is that the people who didn't send the letters, so this first group that was writing the gratitude letters, some sent them on and some just chose not to send them. They were also found, they actually still got the benefit of experiencing gratitude. So simply thinking about gratitude can have a benefit. However, as I told you before about the effects of social bonding, you can get that, certainly that added benefit by sending the letter. So gratitude can also positively impact your health. So research has shown us that grateful people experience fewer aches and pains and report feeling healthier than other people. And not surprisingly, grateful people also are more likely to adopt healthier habits, such as exercise and going to regular checkups. It's also been shown that gratitude can lower levels of inflammation, lower blood pressure, and improve sleep. And on that last one, I don't know if you've ever noticed, if you're struggling to fall asleep, your brain tends to race about unpleasant thoughts. And it can be worries about the future or anxieties about the past. And it can be incredibly frustrating that these thoughts seem to pop up in our heads at the worst possible time. Well, a study found that writing a gratitude journal for 15 minutes each night, people in this study were found to worry less at bedtime and sleep longer and more soundly. So in a few minutes, I'm going to be reviewing some of these gratitude practices, but if you'd like to identify a time of day to do it, you may want to consider doing it before you go to sleep. So gratitude has also been shown to increase empathy and decrease aggression. So in this study from the University of Kentucky, grateful people were found to be more likely to behave in a pro-social manner, meaning showing kindness and consideration to others, even when other people aren't being kind. So in this particular study, participants were asked to write essays, and they received either praise or they were a scathing evaluation. So not surprisingly, the ones who got the negative feedback were more likely to want to retaliate against their critics. The exception was a subgroup that was asked to write an essay about why they were grateful. That group was found less likely to be bothered by their criticism and less likely to seek revenge against their critic who had given negative feedback about their writing. And finally, gratitude helps to improve self-esteem. So one of the primary explanations is that gratitude increases our self-worth, as it gives us the sense that we're worthy of other people's help. So when you recognize someone is looking out for you, that is naturally going to give you a lift. Grateful people are able to recognize people who have helped them in the past get to where they are now. Gratitude also reduces social comparisons. So instead of becoming jealous or resentful when scrolling through social media and seeing people who we perceive as having done better than us, and that can mean people with more achievements or wealth or better jobs, grateful people are able to appreciate and support others' accomplishments and thus experience a greater self-esteem. Again, envy is the opposite of gratitude. So how can we practice gratitude? There are, of course, numerous ways to express gratitude, but most simply, we can just be more mindful to thank people more frequently. That could be your partner, family members, friends, coworkers, and of course, strangers, the people who deliver our packages or check us out in the grocery store. We often tend to assume that people know that we appreciate them, but we need to challenge ourselves by being more vocal about it. And I'll go in a couple of approaches that were used extensively in the research that I just reviewed, but I'll be happy to hear from you at the end of this presentation to learn from you what practices you found to be most helpful. So you heard me talking earlier about the concept of a gratitude journal, which is just simply writing about things that you're thankful for. So a couple tips if you're interested in this practice. Number one, while it's okay to focus on material things, it's important to place more of an emphasis on people and experiences, as focusing on them have shown to have a greater impact on our satisfaction and happiness. Number two is think about what life would be without. So to enhance your experience of what we have, experiences, relationships, basic needs, imagine your life without them. So imagine if you didn't have an income, imagine if you didn't have your support system, and imagine if you didn't live in beautiful San Francisco, which is something I've reflected on a lot this week, given the horrible weather that's taking over most of the country. So that is my personal experience with gratitude this week. Also, reflecting on more difficult times can also enhance gratitude. So if you've ever experienced a crisis, just recognizing that where you are now can help us to focus on what we've endured and help us to focus on our resilience. And third, keep the list short but deep. If you make it too long, it tends to have less of a meaning. And the second recommendation I have is gratitude letters. So if you're going to write to someone that you're grateful to, here are a couple tips. Number one, describe in detail what this person did, why you're grateful to this person, and how what they did affected your life. And try to be as concrete as possible. And number two, describe what you're doing in your life now and how often you consider how they helped you. Do not worry about grammar or spelling. That is not the focus of the exercise. It's even more powerful if you read this letter to this person or over Zoom. And remember, even just going through the exercise of writing the letter can have benefits if you choose not to send the letter. So we're going to go on to the second habit, which is getting out into nature. So the quote here, look deep into nature and then you will understand everything better. And this one's from Albert Einstein. I never knew he said this, but I was very glad to find this quote. So when COVID first hit, I was working with patients diagnosed with HIV in a clinic here in San Francisco. And my first response early in the pandemic was to urge them to stay indoors, as I was worried that their compromised immunity may make them more vulnerable to COVID. And after the first couple of months, we learned more about the disease and how it was spread. And we realized it was going to be with us for much longer than we had feared. And then we learned how to safely socially distance and wear masks. So then my next task was to insist they all go outside. I was seeing not just how the isolation was affecting them, but also how just the lack of access to the outdoors was affecting them. And we all know that exercise is good for our physical health, but research has shown us that doing it outside in nature gives us an even bigger boost, not just for our health, but for our mental health. And it's effective in reducing anxiety and depression, and is shown to have the effect of calming our minds that can lead to physical changes. The good news is that evidence has also shown us that you don't have to engage in hardcore outdoor activities. You don't need to go on a mountain hike or go camping to get the positive effect. Even spending time during your lunch break in a green space can have a positive effect on your health and mental health. And as a therapist, I check in regularly with my clients, not only about their exercise, but about the amount of time they're spending outside as part of their overall wellness plan. So we've learned that exposure to green space is associated with better early childhood neurodevelopment. In this first study from Barcelona, Spain, they followed the progress of 2nd to 4th grade children over a 12-month progression and found a decrease in inattentiveness and an increase in memory associated with greenness in surrounding school boundaries. And in this study out of Denmark, the results showed that there were high levels of childhood green space are associated with lower risk of developing any spectrum of adolescent into adult psychiatric disorders. More specifically, children who grew up with the lowest levels of green space had a 55% greater likelihood of developing a psychiatric disorder independent of other risk factors. So clearly this has a very impactful effect on our development and health. So there have been hundreds of studies that have linked spending time outside to better health outcomes. And spending time outside has shown to decrease the incidence of diabetes and cardiovascular mortality, lower blood pressure and heart rate, and improve immune system function. In fact, these positive effects are so well documented that more and more doctors are issuing nature prescriptions, and they help treat a range of physical conditions from heart disease, hypertension, high cholesterol, diabetes, to psychological conditions such as chronic stress, depression and anxiety, insomnia, and even PTSD. So what are nature prescriptions? Well, they're programs with the goal to help motivate people to be active in parks. So the programs encourage physicians to prescribe physical activity in park settings to their patients. These programs often include a collaboration between the park and public land agencies, healthcare providers, and community partners. So I found this spot promoting park prescription programs, and I'm going to see if you can identify the city. So I wanted to share this because it obviously showcases some lovely shots of San Francisco. And of course, your pharmacist is not going to hand you a Frisbee or a pair of running shoes, but it shows that not every medical intervention requires pharmaceuticals as the sole response to maintaining or improving health. So let's look at some of the benefits of spending time out in nature. So for one, exposure to nature can reduce stress. So a study from the University of Michigan found that exposure to nature results in the decrease of stress hormones. So in this study, they took 36 urban dwellers, asked them to spend at least 10 minutes 3 times a week in a nature setting. And they measured the level of stress biomarkers, in this case, cortisol and amylase, in the saliva before and after these periods. And the study found that there was a 21% decrease in the amount of cortisol and 28% decrease in the amount of amylase. So the study concluded that the optimal amount of time to get this response was 20 to 30 minutes, with a more modest gains after that time period. So nature can also have an impact on our creativity. So if you're feeling stuck or unfocused, you may want to consider going for a walk outside. So a study from the University of Kansas showed a 50% boost in creativity in a group of backpackers after spending time outdoors. And also, just to clarify, this is spending time outdoors without access to electronic devices. So they took subjects which ranged in age from 18 to their 60s, and they were given a test to measure creative intelligence. It was given before they started and then given again 4 days in. And that's where they found the 50% improvement in their scores. And the researcher pointed out that it's the electronic devices that probably have a great impact. So between social media, the endless news alerts, they introduce a sense of emergency, they overwhelm us, they deplete our energy, and that includes our creativity. So these devices can really impact our attention. And he further pointed out that nature is a place where our mind can rest and let down these threat responses. So when our mind can relax, we're better able to be creative and solve problems that allow us to feel happier and engage with people in a more productive way. And finally, nature can make us more caring. So being engaged in nature doesn't just make you feel better, but it can actually make you behave better. In a study from the University of Rochester, they found that people exposed to natural elements rated close relationships and community higher than they had previously. They were also found to be more generous with money. So in this questionnaire, they measured how immersed viewers were in their environments and found that the more deeply engaged subjects were with natural settings, the more they valued community and closeness. And by contrast, those who were more intensely focused on artificial elements, the higher they rated with wealth and fame. So how do we apply these effects of nature into our lives? So I found this concept while I was looking into this topic, and I stumbled upon something called Shinrin-yoku, which is a Japanese term meaning forest bathing, or taking the forest in through your senses. And this has a crossover for the next topic I'm going to be discussing, which is mindfulness. So I'll go ahead and introduce you to Shinrin-yoku.
If you are feeling stressed out, if you sometimes wonder if you are becoming addicted to the electronic screens in your life, or if you're just too busy to catch up with yourself, there's a simple cure. It's called Shinrin-yoku. The instructions are simple. Go to a forested area and wander. You could even go to a park. Follow a trail. Smell the aromas of the trees and shrubs. Listen to the water of the streams. The Japanese have a long tradition of living harmoniously with nature. The term Shinrin-yoku comes from Japan. It means forest bathing. Think of it as bathing in the full experience of the forest, engaging all your senses, letting the sights, sounds, aromas, and sensations wash over you. It sounds simple, and it is, but the results are impressive. Researchers have found immediate and dramatic effects from even 15 minutes of wandering through a forest in the Shinrin-yoku way. Blood pressure drops, stress levels are reduced, concentration and mental clarity improve, and the specialized cells that the body produces to prevent and combat cancer flourish. Besides walking, Shinrin-yoku also includes taking time to simply sit. As you do, your mind naturally settles down, returning from a state of busyness to a quieter, more restful state. Too simple? Try it out and see. Here are a few guidelines. Go untethered. Leave your cell phone. Don't take a camera or other distractions. Leave your goals behind also. Allow yourself to wander. Pause from time to time to see if your body feels pulled in any particular direction. When you sit, be quiet and still. See how the behavior of the birds and other forest life changes after they become used to your presence. If you go with others, make an agreement to refrain from conversation. You can gather at the end of your walk and share your stories. In the hours after you complete your walk, notice any lasting effects. Ask yourself, Do the benefits justify the effort it takes to get outside? We think you'll find it's well worth your time. Give yourself some love. Get outside and enjoy nature the Shinrin Yoga way.
So what are some other ways we can take advantage of nature's benefits? Well, for one, you can walk more. So go find a green space or any kind of nature space, and the beach will work as well. And exercise outdoors if possible. So if you have a choice between a treadmill and going outside, of course, I'm going to recommend you go outside as much as you can. Second idea is to spend some working hours outside. And I recognize that's not possible for everyone, or even probably most people. For instance, I can't do that for my job, but you might be able to consider taking your lunch outside, for example. My husband, since COVID hit, he's been working entirely from home, but he has developed the habit of, he has check-ins with members of his team. And he used to do this, at the computer, and he decided that he's going to start doing these on his own nature walks. So he would go to the beach, he would go to Golden Gate Park, and try to find some new place to go every week. And he finds he doesn't just get the benefit from going on the walk and getting a little bit of exercise, fresh air, and taking in nature, but also felt that he was doing a much better job of being focused on the person he was speaking to, because there's so many distractions that exist at home. 3, simply keep the blinds open. So getting a view of the outdoors can be beneficial as well, even if you can't get outside. We all need a little bit of vitamin D, so we obviously, there's the benefit of having that sunlight. But there's also that bonus if you can just get a view of nature. If you can even look at a tree through your window, that can be helpful. And then finally, if you can plant at home or fill your house with plants, it reconnects us to nature and it purifies the air. So it's a win-win. So how much time should we spend outside? This is just a guideline. I found this study that found that people who spend 2 hours a week or more outdoors reported feeling being in better health and having a greater sense of well-being. So let this just be a guideline if you're trying to, again, create a new habit, but there is certainly no harm in spending more time outside. So now we're on to our third habit, which is mindfulness. So the quote here is, wherever you are, be there totally. And that's the very essence of mindfulness. And mindfulness is a habit I am sure that you've heard about. There's lots of hype around it. It's become a very popular mainstream practice. And it's also been studied extensively. Its benefits are widely known, really too numerous for me to list in this presentation, but we know it's been shown to improve physical and mental health. I easily could have done an entire lecture on this topic alone. So today I'll just simply be providing a basic introduction to this topic. So let's start with the definition. Mindfulness is maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensations, and surrounding environment through a gentle, nurturing lens. So there's really 2 parts of this definition to focus on. And the first is that moment-by-moment awareness. So it's estimated that about 95% of our behavior runs on autopilot, and it has to do that so that we can function. So consider breathing, for instance. We can take control of that function, but when we're not focused on it, it happens automatically. So mindfulness is that executive control rather than autopilot. And it enables us to have intentional actions, willpower, and make decisions. So this means being fully engaged in the moment. The second part is that gentle, nurturing lens. So this means observing without judgment. A very important aspect of mindfulness is training our brain to not be self-critical when it comes to our thoughts. So if you're practicing mindfulness and you're thinking, oh, I shouldn't be thinking that, or that is the wrong thought to have, that is counter to the entire sort of essence of mindfulness. So mindfulness requires us to hold a compassionate view of our experiences. So what's the goal of mindfulness? The goal really is to cultivate perspective on one's consciousness and identity that can bring greater peace mentally and relationally. It can be used in mindfulness-based therapies to address stress, anxiety or pain, or simply to become more relaxed. And again, while it's been shown to serve many purposes, it's not a cure-all. So I told you I was going to reminding you about this again. So mindfulness-based practices and treatment should not be the sole intervention for health and behavioral health issues. Okay, so the introduction of modern mindfulness into Western culture. So we know mindfulness has its roots in Buddhist meditation practice that goes back thousands of years. And the mindfulness movement in more recent years is largely credited to University of Massachusetts professor Jon Kabat-Zinn, who studied Buddhist mindfulness-based practices and developed a more secular mindfulness-based stress reduction, or MBSR. And he developed this in the late 70s as a way to treat chronic pain. Previous therapies focus on avoiding pain, while his approach, which seems a bit counterintuitive, was to be fully present. And this was also found to be useful practice to treat anxiety and stress. And just for anyone interested in MBSR, it's an 8-week program that uses sitting meditation, body awareness, and mindful movement. So what does mindfulness look like? So it's helpful to think of mindfulness as either passive or active. So passive brings us to the mind. So it is what we think about when we think about meditation. In the active meditation, we wait for thoughts to appear, we acknowledge them, and then return to focusing on the breath, or another anchor such as a mantra or a sound. Whereas active brings us to the activity. It focuses attention on the moment as we're occupied in an action. So examples of this that a lot of people think about with regards to mindfulness are yoga, Pilates, Tai Chi, or Shinrin-yoku, which we just watched the video on. But we can also bring this to everyday activities that may otherwise seem mundane or ones that we may do on autopilot. For example, driving. So when we're driving, that's a perfect example of an activity we tend to do on autopilot. It's also one where we find we tend to resort to fight or flight responses, giving way to road rage. So if you're thinking about trying to practice mindfulness while you're driving, you might want to consider taking a deep breath, turning off the radio so you can be fully present to the activity of driving. Notice how your hand is gripping the wheel. Scan your body for tension. Pay attention to your surroundings and resist the urge to get caught up in other drivers' actions or traffic. And ask yourself what you need. Another activity that we tend to do, we race through, we do it because something we have to do several times a day is eating. So mindfulness can actually turn eating into a much richer experience. So again, include thinking about taking a breath before you get started, slowing down, focusing on the taste and the texture of your food, and listen to your body about the hunger and about feeling full. So how often and for how long to get the positive effects of mindfulness? Well, there really is no harm in practicing mindfulness all the time, but even committing to the shortest practices, maybe even 5 minutes a day, can have benefits. It's better to think about doing it 5 minutes a day than, say, for example, an hour 1 day a week. It's a good idea to start small and then perhaps build to longer periods if you can. And like I said in the beginning, the routine needs to be realistic and achievable if you want to make it a habit. So how can it help us? Well, for one, there's evidence that mindfulness shrinks the stress region of your brain. So it can shrink the size of the amygdala, which is the region known to control stress, where the fight or flight response is processed. Mindfulness has been shown to weaken the connection between the amygdala and the rest of the brain, while at the same time, the connections between the areas associated with attention and concentration get stronger. Number two, it can improve your working memory. So your short-term or working memory is inhibited by something called proactive interference, which is just a fancy term meaning where prior memories can be distracting and interfere with your ability to retrieve more recent information. So mindfulness training has been shown to improve working memory as it reduced that proactive interference, because focusing on the present moment and minimizing distraction is the core concept of mindfulness. Third, it can make you more resilient. So this just means it can improve your ability to recover from setbacks. So researchers have found that psychological resilience is more pronounced in mindful people. So how does it do this? Well, mindfulness keeps people from perseverating or obsessing on their problems or failures, which will increase the likelihood that they will try again. Mindful people can cope with difficult situations without shutting down emotionally. So pausing to observe thought processes prevent us from getting caught up in a setback. And finally, it decreases reactivity. So mindfulness alters that knee-jerk emotional reaction, or how we often respond to something without giving it much thought. In one study, researchers studied participants who viewed emotionally charged images, and those in the group practicing mindfulness were found to have a greater reduction in emotional reaction than those who viewed the same images without mindfulness practices. It does this by increasing our exposure to the stimuli that provoke these reactions while helping us maintain an open, non-judgmental stance. So again, back to John Kabat-Zinn of MBSR, the whole point of his program is to help us to respond rather than to react to stressful situations. So some ideas on how to practice mindfulness. Well, I talked previously about how cell phones can be terrible and that they can be distracting, but they also have some really great benefits, which is that you can get, there's a number of apps that help with meditation. And these are 4 that I had found. They're really great, have a lot of different features. They also have features that can help with relaxation and sleep. Most of them have some free content or at least a free introductory period, but unfortunately, a lot of them do come with a monthly fee. YouTube has an endless number of free meditations if you are interested. And if anybody has an idea of a good app that is free of charge, please let me know at the end of this presentation and share it with the group. So here is an example of a meditation from one of those apps, the Calm app. This is just a snippet of one of those meditations. So I wanted just to give you guys just a sense of what that might be like. So get comfortable. This is only a minute. So let's go ahead and give it a try.
Close your eyes, and we'll take a few moments to calm your mind and body. Soften your face, your neck, and shoulders. Do your best to fully let go. And turn your attention to the breath. the calming breath, the soothing breath. Take long, slow breaths, full and deep. Breathing in, I am calm. Breathing out, I'm at peace. Close your eyes.
Okay, I hope I didn't put him to sleep. So this next activity is the 5 senses mindfulness exercise. It's also known as a grounding exercise, and which could actually be very helpful if you're feeling anxious. And it's a good exercise to ground you if you only have a moment. And the purpose, again, is to notice things you're experiencing through your 5 senses. So first, notice 5 things that you can see. Second, notice 4 things you can feel. And that could be something like not just that you're feeling tactily, but it also could be the air temperature, how it feels sitting in a chair, the feeling of the clothes on your body. Third, notice 3 things that you can hear. Fourth, 2 things you can smell. And then finally, noticing 1 thing you can taste. And I just really like this exercise because it's very portable. You can do it anytime, anywhere. So some mindfulness tips. So in the do column, number 1, incorporate into daily activities. So I spoke before about driving and eating. Mindfulness is something that can be incorporated into just about any activity. And they're a helpful way to reset your focus. Number 2, if you're meditating, please consider scheduling it. You're more likely to do it if you have a time or routine around mindfulness practices. That may be at bedtime, it may be first thing in the morning, whatever works best for you. And third is to be patient with yourself. So it's very normal for the mind to wander. People often think that they're bad at meditation or mindfulness and want to give up due to the challenge of not getting caught up in the thoughts. It's important to appreciate that this is what our minds do. This is the way our mind's supposed to be at their baseline. And thoughts are not the enemy of meditation, but continue to try to work to return to experiencing the moment. Okay, for the don'ts, number 1, don't just practice when things are difficult. I found a couple good metaphors on this one. Trying to practice mindfulness when you're stressed out, it's like learning to ride your bike during an earthquake or learning to drive in a thunderstorm. It can be very difficult to focus if you're feeling particularly stressed out or anxious. And number 2, don't expect to feel better in the moment. So while being mindful is supposed to make us feel better in the long run, it's important to note the experience may evoke some negative emotions, such as sadness, jealousy, anger. The goal is to be present to these thoughts and emotions, again, without judgment, and to learn to be less reactive to them. And while mindfulness is a practice that's been shown to have benefits from those suffering from behavioral health issues, such as depression and trauma, it's been very evidence-based to be helpful. It's important to note that practicing mindfulness can bring on these difficult feelings and memories. Bottled up emotions can come out as a result. So if you have any concerns about this, it may be beneficial to consider meeting with a therapist who is trauma-informed. So I'm going to show you some gratitude right now. And thank you for your time. I really appreciate your joining me, and I'm happy to take any questions, but I also want to hear about your experiences, thoughts, suggestions with regards to these practices. I'm still learning about these myself. So thank you.
I'm sure that I speak for everyone, but when I say thank you, Leah, this is a time where we'll get to the questions that have been pouring in while you were doing a lecture. So the first question asks, what if you simply do not have the will?
Well, I think it's important to recognize, where you are, and sort of having that sense of, what you're capable of doing in the moment. I encouraged in all of these practices to start small, right? And then we can build on them, and even just trying to, in small doses, make a habit. If you're finding that motivation is really getting in your way, and you're having greater sort of behavioral health challenges, I would recommend consider perhaps meeting one-on-one with a therapist.
Next question. What is the minimum time you would recommend to stick with a gratitude journal to really start seeing results?
Good question. I put up a bunch of slides about recommendations in terms of frequency and amount of time, just based on what I was seeing in the research. I think it's just, again, whatever feels right in terms of making it a habit. If you're doing a journal, I would say perhaps starting at least once a week. But whatever feels right to you.
Oh, good. Next question. This person says, I struggle with consistency. I tried gratitude journal, but kept forgetting about it. What are your tips to get daily gratitude reflection?
Good question too. Yeah, again, the journal doesn't have to be something terribly formal. When I started reading more and more about gratitude and trying to incorporate it into my own life, I just started a practice weekly of texting myself a list, trying to keep it very short but deep. So if journaling becomes a bit of a hassle because you don't like writing or it's hard to find the time, simply just making it a short few word list that you can write down in whatever way feels comfortable, and just take a few minutes to reflect on, you'll have the benefit.
I think texting is a really cool idea. I have never really thought of that. Writing always starts to become a process for me. Like, I worry about my handwriting, I worry about how the page looks, but I guess texting, you're just pretty much just throwing words in there.
Yeah, and like, yeah, that's, whatever works, right? I mentioned too about the gratitude letters. It's really important to not get caught up in worrying about, you're not supposed to have any anxiety when you're doing this, right? This is something that's supposed to make you feel better. So if you are focused on things like grammar and spelling and form, that's not what we want. It's just about literally just kind of releasing that and identifying those items out there for you to see.
Sounds good. This next person asked, I have adults, ADHD. Sometimes taking a break makes me feel guilty because I'm afraid to step away and lose focus. How can these 3 practices help me?
Yes, well, I think part of what we learned about in learning about nature and that backpacking trip is that we need to take those breaks. It's that prefrontal cortex, that thinking part of our brain that we're engaging all day long, including being on our devices, that can actually become harmful. Like our minds need a rest. And so instead of thinking about it as something indulgent, think about it as something that is really promoting wellness. So it is a form of self-care. So that's why it's important to take those breaks. And it's even easier to do when you're outside and you don't have those same distractions.
Yeah. And I speak on it too. I'm not a behavioral specialist, you know that, but I used to work in education, and I worked a lot with students. And on the note of productivity, it was always emphasized in the spaces I worked that if you don't give your students a break, they will take that time from some other activity. They'll get distracted from assignments or activities because, well, they didn't get their break, and they may not know to communicate that. But essentially, if you don't give yourself the break, you'll find some other way to carve it out, and it might just not be how you want it.
Exactly. Again, it's in service of wellness. I was in my office the other day. I was typing up a document, and something popped up on my screen and said, "Don't you think you need a break?" Mm-hmm. And I was like, "Oh, that's so nice. My computer cares about me." So that's why it's good to make it a habit, because again, if you sort of recognize its benefits and you make it, intentional, you're going to have a much better outcome.
I think that's the key, like wanting to be intentional about it.
Mm-hmm.
Next question. We have 6 more here. We've answered 4. What are other ways to promote wellness other than gratitude, nature, and mindfulness?
There's too many to mention.
I know that you mentioned you could do a whole other lecture on mindfulness alone. So I know that this is probably a big question.
It is. I might have to do another presentation. Oh my goodness. I don't, off the top of my head, it's very difficult. Actually, there was one other habit I was thinking about presenting on, and that was setting boundaries. And I sort of struggled with that because I just couldn't find the time to put them all in. But yeah, I'm not sure I have a quick answer to that one. But there are obviously a number of other wellness practices that we could certainly spend time on.
Yeah, if you're curious, please feel free to write this down in the survey that's sent out later. Happy to take ideas from you and create more health education presentations down the line.
Absolutely. And just because I'm on the spot, I can't think of any, but I know that if you gave me a few minutes,
we can
a little time to
return
research,
to
I could come up with a new list. Yeah.
Of course. And we can return to this if you want. All right. So next question then. What is the difference between a licensed clinical social worker and a regular social worker? Do both accomplish similar counseling?
Yes. I'm not sure I know exactly what a regular social worker is. So a social worker is somebody who has completed their master's level social work degree. And then a licensed clinical social worker is you basically have about a minimum of 2 years of supervised experience, and then you take an exam, and then you get a license. And then by maintaining that license, that is just, it's a recognized certification, I think, to do a lot of different types of work. So I'm not entirely sure I have a really good answer to that. I mean, I think sometimes the two terms are just conflated. I don't typically always introduce if I'm talking to someone on the phone and I announce my role, I don't typically say I'm a licensed clinical social worker. I'll just say I'm a social worker. So the license part is just basically a certification.
Thank you.
Mm-hmm.
Is there a difference in ease or effectiveness between passive and active mindfulness?
Ease or effectiveness? Good question. I think I don't know about effectiveness. I think they are just different types of practices. And you can engage in whichever one feels better to you. In terms of ease, I don't know. I mean, I think, like I said, I think the reason I mentioned that don't is a lot of people are very hard on themselves because when you start practicing meditation, it can feel very awkward and difficult simply because you're trying to not focus on your thoughts. And that is counter to the way we sort of live our lives. And so that tends to be a little bit more difficult, at least initially. But again, the point is to not be hard on yourself, but just to continue to try again to focus on the present moment. So I think my only feedback for that is that people might find meditation, strict meditation, to be a little bit more challenging, at least to start. But they certainly both have, they're both very effective.
Thank you.
Mm-hmm.
Next question. Why does proactive interference occur? And is it a bad habit?
No, it's just the way our minds work, right? So proactive interference, it's just, we tend to have that distraction of former memories. And that is just the way our brains are. And again, mindfulness is about keeping us in the present moment. And then that is helpful to us so that we can, have improved concentration and memory. But it's not necessarily a bad thing. It's just a quality of the way our brains work.
All right. Next, for all of these, is there a need to do something at the same time every night or every day? For example, gratitude writing same time every night and morning mindfulness every day at the same time. So I guess this person was getting at just consistency, but at the same time, when doing these practices.
Yeah, again, I mentioned, picking a time, because that can just, if you pick a time a day, that helps you to sort of set a reminder to yourself so it becomes an easier habit. There is no, it's not a difference if you do it in the night or in the morning. It's just really whatever makes it more likely that you're going to do it. And again, in terms of, frequency, you have to find something that is realistic that you can stick with. So, for example, with the mindfulness, it's better to do just a few minutes a day rather than one big chunk kind of once a week.
Makes sense. This is the second, or this is the last question, and we can return to the other ways to promote wellness question if you'd like. So this question asks, you mentioned grounding for anxiety. Are there different mindfulness activities that address different needs? And what are some?
Good question too. It's interesting, that grounding exercise. I just always knew as a therapist that it can be very useful for anxiety. And then as I was looking into mindfulness, I saw that it's also just considered a mindful activity. There, certainly are dozens and dozens and dozens of different mindful activities that you can engage in. Again, I think starting with, very basic mindfulness activities to start, so that you can get in the habit of thinking mindfully. And then if you are more focused on attacking a specific area or a specific problem, you can turn to these mindfulness apps. And there is one for every single category that you can imagine. For example, for sleep or for depression or for procrastination, or any kind of problem that you can imagine, there are guided meditations to address them.
Great. Would you like to return back to the question asking what are other ways to promote wellness other than gratitude, nature, and mindfulness?
I did think of something, Twin. And again, there was another topic I was going to actually put in this presentation when I had to try to whittle it down. It was really those 5, because I had the 3 that I presented on. One was about setting boundaries. And that's, setting healthy boundaries in our relationships. And then the other one was pro-social behaviors. And I mentioned that a little bit with gratitude, but pro-social behaviors are the ones where we are basically showing concern and compassion for others. And so pro-social behaviors can be anything from just, showing kindness to spending more time, volunteering or helping people out. And then there's all sorts of evidence that shows that engaging in those types of behaviors, of course, can, really have a very profound impact on our happiness and our wellness.
Nice. So pro-social behavior and setting boundaries are 2 examples. Great. I haven't seen anybody raise their hand in that time or new questions come in through the chat or Q&A. Would you like to leave our audience with anything else? I just want to thank everyone again for joining. I really was very excited about this topic and, would like to do more of these. And so I just appreciate you taking the time to join me and, feel free. I appreciate the feedback so I can get better at this. Thank you so much. Awesome. And someone shared a resource in our chat, and it's not visible to the rest of the attendees, but I will be sure to include it in the post registration. I keep saying registration, but the post event email. It's a resource for San Mateo County offering Headspace for free. Wow, that's pretty cool. Nice.
I
So
was
I
gonna,
will include that.
yeah, I was going to mention that due to the pandemic, I think I have Headspace, by the way. That is the app that I have on my phone. And I love it. It's wonderful. They have all sorts of meditations, 1,000 different topics once again, and you can do them for 5 minutes, 20 minutes, and longer. So there's a great variety of meditations and other things that they have on the app. And the reason I downloaded that one in particular was it was free for anybody that was considered a frontline worker in healthcare due to the pandemic. So that was my reason. I'm not sure if they're still offering that, but it's still active on my phone. So I wanted to give a good shout out to Headspace.
Nice. Well, thank you for that. That was awesome. I love it when we can,
Yeah, thank you, Jill.
share resources across. Great. Just also a friendly reminder that very in line with Leah's mindfulness section of the presentation, we have a group class called Mindful Eating, led by one of our registered dietitians, Jason Mosel. Eating is something that can easily become disordered, and it's something that you can just try to cram into your day because you might be going too fast, or it's just something people don't really think mindfully about. And this class is great because you get to sit in a very comfortable space, especially now that you're at home. You get to eat meals together and practice in an intimate space with a closed group of people who are open for discussion, and it's all facilitated by Jason. So if you visit our website, chrcsf.org, and click into events, you'll not only see all of the events that we have for free, you'll also see group classes. And here is Leah's class on the 18th. And next week on the 25th, we have a deeper understanding of the ear, hearing, and tinnitus. It is led by 2 audiologists from University of the Pacific, and it will also be virtual and recorded. So feel free to register even if you can't make it, because that's how I can send everyone resources that were shared in the lecture and also the recording. So back to mindful eating, because we were talking about mindfulness. This is Jason's mindful eating class. It is an hour and a half after work, and it starts beginning of March, or March 4th, really. And it goes for 4 weeks. And you are asked to enroll in the whole series because, sort of like Leah said, consistency helps build the habit, and it's not a class that we can do all at once. And that's why we meet 4 times. And you sign up, we'll contact you, and hopefully we'll see you there. Leah, is there anything else that you would like our audience to have before they leave?
No, I think we're good. Again, thank you so much for joining.
Awesome. Well, thank you everyone for taking the time this afternoon to join us. I really hope to see you again next Thursday for our audiology lecture about tinnitus. And well, I hope to see you again for all of our health education. Please continue to check us out on our website.